right before Thanksgiving, just a couple days before that, the Biden administration made a proposal that suggested that government programs like Medicare and Medicaid would cover the cost of popular semaglutide medications. You'll know these medications as by their name sometime as Ozempic, and these are medications that have been used to treat diabetes for many years that now are showing to have a weight loss benefit. The Biden administration does not call it a weight loss drug. They're calling it anti-obesity medication. And that's what they're saying needs to be provided to those on Medicare and Medicaid because, again, looking at their language, obesity is a chronic illness and needs to be addressed through these medications. Why this matters is big picture. Again, stepping out of politics, you have about more than 100 million adult Americans considered obese. So that's only adult. That's not considering kids. And although obesity rates seem to be declining somewhat, and some are wondering if it's because of these drugs, it's still a major issue. And it's a major drain on taxpayers too. I was looking at the money for this, thinking about, well, what's the best use of our money? If I was thinking about, okay, whether or not taxpayer money should help provide Ozempic to, let's say, a Medicaid recipient, like what is the best use of our money? So listen to this. Our cost of healthcare issues for all Americans with or without Medicare or Medicaid that are related to obesity is an estimated $173 billion a year. The cost of coverage of these new medications to Medicare would be $25 billion. And to Medicaid would be $11 billion over the course of the next decade. So the argument is that this is potentially a good investment. You have people that will be able to lose some weight or combat obesity, and then those comorbidities that they're also getting care for and receiving prescription for go down. That's in theory. Timing of this by the Biden administration is really important. So they put this out in mid-November, but there's a 60-day review period. So for this to actually happen, where Medicare and Medicaid would cover these medications, would actually have to go into official effect under the Trump administration. And so it's something that I'm curious about. I see these drugs being talked about, being used a lot, whether it's as an anti-obesity medication, but also in more of a recreational way. When I'm driving down the street near where I live, out in the suburbs of Austin, there's a sign, one of those foldable kind of billboards that people could put at this little sign that they're putting outside their business that actually is advertising semaglutides, because many people don't even have a medical degree that are administering these drugs. So we're seeing more people use it. And the question is, what's going to be the effect? And is the government going to pay for it?